is that whatever that cell is supposed to do, whenever you use laser and light therapy, it just allows the cell to do it better. So if that cell is supposed to produce a neurotransmitter, it'll do it better. If the cell needs to heal, it'll heal more efficiently, et cetera, right? So it helps to modulate inflammation.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have a special guest on the line. His name is Dr. Brandon Crawford. Dr. Crawford is known for his work and advancements in laser and light therapy, also known as photobiomodulation, specifically within functional neurology. He's lectured globally on co-activation for photobiomodulation and its relationship with neurophysiology. A lot of hard words here for me. Dr. Crawford is currently authoring a book on the most effective methods to creating positive neuroplasticity for brain injuries of all types. And Dr. Brandon Crawford, thank you so much for joining us here today. And can you please expand a little bit more as well on your bio and your background, because it's extremely impressive, but there are a lot of words that are very hard for me to pronounce and a long list of accolades as well. So I'd like to have you expand on what I just started.
Absolutely. Yeah. Well, thanks for having me. And, thank you to you and for everything that you've been doing and all the good work and people that you're helping. So definitely appreciate the good work that you're doing. So basically, so I'm a fellow of the International Board of Functional Neurology. I do have a specialty in childhood neurodevelopmental disorders. The functional neurology is a very interesting and rapidly developing part of healthcare where we're the ones that are really looking at how the nervous system and the neurophysiology actually works and functions. So if there's something that someone's experiencing symptoms and they can't really find it on imaging or on labs or something like this, they can't really explain it, we're the ones that really dig in and look at whether it be muscle imbalances or coordination issues or primitive reflexes or these things that give us a functional reading on the neurology. That's what we do. And then we develop strategies to actually create functional and sustainable change within the neurophysiology. So it's amazing. It's fun. It's a whole lot of fun, actually. And like I said, my specialty is actually childhood neurodevelopmental disorders. And so the early part of my career, I really looked at, autism and ADHD, Tourette's, OCD, dyslexia, those things. I myself had Tourette's and OCD growing up. I had vocal tics and other types of tics. One of my children actually had Tourette's as well until we addressed it. I no longer have any issues. He doesn't have any issues. So, and it wasn't until I really understood the functional connectivity of the brain and how we need a balance and we need these networks to be fully integrated to really give a smooth, coordinated response and to give proper top-down regulation over these systems, right? And so that's what functional neurology and specifically developmental functional neurology really brings to the table. But then we have to throw in this concept of laser and light therapy, this photobiomodulation stuff, right? So what we have to understand is that cells are extremely responsive to light, and we need to support our cells, right? So just like we know that we need to take different vitamins and we need to be well hydrated, and right, cells need nutrients, they need fuel. Well, one of the primary drivers for cellular fuel and energy is actually light. And there's certain wavelengths of light that we can use clinically to have an even more dramatic and pronounced effect on cellular metabolism. And so if I'm trying to rehab a brain injury or a movement disorder or something like that, and I want to create neuroplasticity as quickly as possible, I really have to be specific and targeted with how I drive these cells. And if I do it too quick and I exceed a metabolic rate, well, I can start to create compensation. I can make the cell go dormant. I can create, right? There can be some negative fallout. So we have to make sure and support those cells, just like you wouldn't go run a marathon if you were dehydrated. We have to make sure that we support those cells with one of its primary fuel sources, which is light, which then gives the cell things like ATP, it creates exclusion zone water, etc., so that we can create sustainable change. And the cool thing about light is there's so many different things connected to it. And we go in so many different rabbit trails, which I'm sure we're going to circadian rhythm, to, growth factors for the brain, et cetera. So that's really, my focus is functional neurology and this thing called photobiomodulation, I've been fortunate enough to be a part of thousands of different, types of cases all over the world. We have various clinics where we specialize in using laser and light therapy for various complex neurological conditions. And it's just been an amazing career so far. And I'm just happy to be able to serve people in this way.
Amazing. Yeah. And I know your practice had a backlog of over a year of a waiting list at one point of people just trying to see you for your expertise. So it's pretty incredible. I definitely want to get into more of the kind of general aspects of light that our everyday listener can get some value out of. But first, I do want to ask about some of these specific things that you treat, specifically many people with kids, and the kid may have been diagnosed or they may suspect that the kid has ADHD, Tourette's, like you just mentioned. So is there like a specific protocol or something that you do that, and does it pretty consistently work? Does it depend on certain factors? I'm really curious. How does that work?
Absolutely. So the first thing to kind of understand is that we have these diagnoses, and unfortunately, they're just labels. There's things like autism and ADHD and dyslexia and these things. And what people need to understand is that there's the spectrum, right? So there's spectrum disorders, which is what I'd rather discuss. And then along that spectrum, what you're going to realize is that each function, like attention, focus, speech, all these things have different subnetworks that control them, right? And so we have this brain that has this blueprint for development. And we all inherently understand this because we know that a baby has to crawl before they walk. That just makes sense. We're not going to take a 3-month-old baby and stand them up and say, okay, little Johnny, it's time to walk. We understand that there's mechanisms that have to take place in order for that baby to be functional enough. They have to have enough neurological integrity. They have to have enough strength, etc., to be able to walk. Well, our brain has this developmental pattern that it needs to go through in order to develop. And if there is a lag or something that happens that causes what we call a developmental asynchrony, or just a lag in development in a certain network or subnetwork, then there's symptoms associated with that. And those symptoms are correlated with whatever network or subnetwork may have that lag in it. And that's something that we specialize in, is actually performing our neurological or functional neurological exam and actually identifying, number one, what networks, are lagging here. But then it also gives us strategies in order to develop those networks and then balance those networks. So the blueprint is like this, like from a broad level overview, we have our sensory systems that have to be online. So we need our sensory systems and we can evaluate that. And then we have our primitive reflexes, which are so important. Most people just think that those are a part of like a newborn exam, in which case, unfortunately, most doctors are not even looking at these in kiddos. But anyway, then we have our primitive reflexes, and then we have our postural reflexes, which is connected to our reticular activating system, and that's our filter for the world. And we can discuss that more if wanted. And then we develop our core stability, our vestibular system, our eye movements, and then our cognition. So we go through the checklist there, and we have a meticulous way to examine all of that. And so, for example, if I'm looking at a kid and they have impulsivity and all these symptoms that would be diagnosed as like ADHD, well, maybe the solution isn't just to give them Ritalin and just push a neurotransmitter. Maybe the solution is actually that you have this imbalance in the brain and this underconnectivity specific to these networks that help to drive this focus and attention. And the opposing networks are maybe they're functioning right where they need to be, or maybe even a little bit above, right? But that's giving rise to an imbalance in the brain, which then gives rise to an imbalance in function. And so all we do is we then go, okay, based on the exam, I see these primitive reflexes, I see these networks, we're going to drive those, create neuroplasticity, and the brain goes, and we get this balance in function, and then we no longer have this issue, which used to be called ADHD. And that's how it works, and that's how we see, we see very consistent results with that. And there's even literature that's now connecting, and lots of literature actually connecting things like primitive reflexes to diagnoses like ADHD, autism, and various neurobehavioral disorders. And now looking at depression, schizophrenia, anxiety. So it's even, going into mental disorders and whatnot too, because really what is that? Well, that's still just a developmental issue in the brain. So the process is easy. I say easy to us. We have it outlined and it's very clearly defined. It's objective and it's reproducible. And yes, we get phenomenal results.
That's incredible. And so what do you do then? So you do these tests, you figure out where the imbalances may be. And then I've seen pictures, videos of you using lasers, on kids in different areas of their head, different things like that. So then I assume that's when maybe your special training comes in of knowing exactly what type of laser to use, where to use it. Can you talk a little bit about that next step?
Absolutely. So we've identified the area that we want to drive. We see the weakness, we see the imbalance. And now it's a matter of firing that network. In order to create neuroplasticity, we need frequency, intensity, and duration of stimulus. Okay, so we need to drive the network, preferably in novel ways, and then also using these inborn mechanisms like primitive reflexes and various ways. But then we also need to make sure that cell, those networks of cells, have enough energy in them so that they can be fired repetitively and in such a way that we can create neuroplasticity rapidly. And so what we can do is we can use the laser that, the lasers that we use have a specific wavelength. They have a certain specific frequencies depending on the area of the brain that we're wanting to target, right? Because each part of the brain should fire with a different frequency or an oscillation rate. So we have that mapped out. And as we're stimulating that part of the brain, doing whatever exercise or whatever that we've deemed necessary, we use the laser over that network to improve blood flow, improve cellular energy. It also increases growth factors. It does help establish neuroplasticity and basically helps us get there faster. The cool thing about laser therapy, light therapy, is that whatever that cell is supposed to do, whenever you use laser and light therapy, it just allows the cell to do it better. So if that cell is supposed to produce a neurotransmitter, it'll do it better. If the cell needs to heal, it'll heal more efficiently, et cetera, right? So it helps to modulate inflammation. It helps to balance things. That's one thing that the literature is very clear about, is that laser therapy is known as the great regulator. So it's not going to necessarily push anything in a certain direction. It's going to help to restore balance to these networks and these cellular environments. So that's why I love it so much, because it has such a high safety profile, but yet we get these dramatic effects from it.
That is really incredible. And it's weird because I don't hear many people talking about this. I don't hear many doctors or even clinics or people doing laser therapy. So it's really, really fascinating. I'm trying to think where we should go from here. Is there, I guess for people listening who are wondering, I guess for adults, are there any issues that you would recommend people may want to look into laser therapy for, again, maybe just a normal adult, maybe they're dealing with depression, maybe they're dealing with lack of energy, maybe they're dealing with inflammation or a pain in a certain area of their body. And would they need to specifically seek out someone like you? Or I guess many people are wondering, oh, what about these red light panels? Or can I buy a laser on Amazon and do this on myself? Curious to hear what you say on that.
Right. Yeah. So all very, very good questions, and all questions that I get asked quite often. And so here's what I'll say. A photon is a photon, right? Your body does not necessarily know if a photon is coming from my laser versus an LED panel versus whatever, right? So a photon's a photon. Now, there are other parameters about that laser beam that can be altered in order to produce a better effect. So here's what I tell people. Red light panels are amazing. I have several at my house. I have several in the clinic. We want to use things like that to in general deliver more energy to the cells, in general help with overall health and wellness. And if we're just trying to maintain health and wellness, absolutely go for it. I think that's a great thing. Where I get a little more specific is using things on the brain.
Yeah.
because the research I've looked at and the pilot studies that we've done do show us that we want to be specific about the wavelengths. We want to be specific about the duration, the dose. We want to be specific about the frequencies that we pulse into the brain. And now what I'm looking at is we even want to specifically look at the duty cycle and the pulse width of, the light that we're pulsing into the brain as well. And, a lot of people are not going to know what I'm talking about there, but that's nerd talk for, how are we modulating that wave going into the brain? So the answer is, if you're trying to gain an edge, if you're trying to improve your overall health and wellness, a great strategy is to use a red light panel. And obviously that's more economical, and that's fantastic. I would suggest using it earlier in the day. There's good studies that tell us if we have that red light exposure early in the day, like upon waking or first few hours of waking, it can have a more pronounced effect. I personally like to get my red light exposure early in the day, but then also in the evening. But in the evening, we do want to be careful not to get too much in the eyes, because we can still disrupt our circadian rhythm. So there's definitely great arguments for their overall health and wellness. Absolutely go for it. If you're suffering from, something like a pain syndrome, injured knee, injured back, or, something like that, same thing. Red light panels are great. But now we're talking about still, it's going to be better and more specific if we can specifically talk to those areas of the body. And if we can actually stimulate those areas of the body as well. That's a term that we call co-activation. So we can actually have a greater influence on different tissue in the body or cells in the brain if we co-activate them to increase their metabolism so that the light has a more specific influence on them. So it can be beneficial to, seek help from me or someone like me in that regard. But for pain syndromes, I would say that you're still, working in the correct vein to still go after the general use of, like an LED panel or something like that. I would advise to not pursue like getting, a cheap laser from, China or something like that, just because the diode quality is not necessarily great sometimes. And those wavelengths can vary widely based on the diode. So I would watch out for that. And the difference between like an LED panel and a laser is a diode versus an LED. They both produce light. They both do a great job of doing that, but laser therapy is coherent. It produces a much more collimated type of light beam. The LED is more scattered. But again, they're both photons, are both great. Now, if we're talking about something like depression, anxiety, those types of things, then yes, I would say let's set up a consultation. Let's see what's driving that. Was that a developmental thing? Was that a mild or moderate head injury that, maybe you didn't have any symptoms until later in life? Is it a neuroautoimmunity? What's going on there, right? So that one, I would definitely want to get in the weeds and kind of, specify how we should navigate this a little bit better. But in general terms, look, laser and light therapy, it's safe. It really is. Be careful for using it on the head because there's certain parameters that we want to work in. I would definitely say leave that to the experts. But for general health, wellness, pain syndromes, those things, go for it. Use it. Watch out for altering the circadian rhythm at nighttime. And we can talk more about that if we want to. But those are my thoughts on that topic.
Yeah, that's great. And just to kind of wrap up on that topic, do you have any recommendation for which red light panel you like the best for people who are looking into that? And then the other question I have is, what if you're getting sunlight every morning? Does that have the same effect or possibly better than using a red light panel?
Great question. So I'm actually going through, we're actually developing our own LED panels right now in NeuroSolution. So that is something we're doing. But until then, I use platinum LEDs. They're a great quality. I use them all the time in the clinic. They hold up very well. I've been impressed with them. So that's what I'm using currently until we have our own on the market. Great question on sun exposure. So the sun, the natural light that's out there is always going to be preferred, right, for general health and wellness, right? You're not going to supplement an LED panel for that early light exposure. That's not going to be an equivalent thing. And you're right. We want to be outside as that sun's rising so that we can experience that low angle sun. This is so important for setting in motion the proper circadian biology, proper circadian rhythm. This is way more than just sleep. Your circadian biology, it manages clock genes. It helps with stem cell activation and differentiation. It helps with fibrosis in the body. It helps with inflammation modulation. It helps set the tone to have proper pulses of cortisol and dopamine and all these different neurochemicals. We have to, I would argue, we have to get that early morning sunlight. I also tell people that I also want you out midday. I want you out when the sun is at its peak. I want that far infrared light coming down. That's a longer wavelength. That's why it's warmer. It's deeper penetrating. It's actually affecting different parts of the cell, right? So every wavelength of light has a different receptor that it stimulates in the body. And then, very important as well, be outside as the sun is going down, as the sun's setting. Again, it's signaling to your brain that, hey, it's nighttime. It starts to change your neurochemistry. It starts to prepare you for sleep. It also starts to prepare you for the morning when you should wake up, right? So super important, and we can't substitute one for the other. But one thing that is so important to understand here is that our society right now, we are ruining our circadian biology because we're looking at a screen all the time. We're looking at our phones. We're looking at computers. We're looking at iPads. We're looking at TVs. And this is unfortunately not okay. And so the supplementation of the red light is vital, in my opinion. And here's why. Whenever you look at the type of light coming off the screens, it's a high frequency white, blue light, whatever you want to call it, 490 nanometers. There's actual studies now that show this type of light exposure to our retina actually causes necrosis. So it causes the retina to start to break down. That's important, yes, for eye health. But also we need to realize that the retina is brain tissue. It's diencephalic tissue. It's an extension of your brain. This type of light exposure greatly disrupts circadian biology. I can show you a timeline or a series of papers of literature that explains the progression of getting too much high frequency white and blue light, how it leads to obesity, how it leads to diabetes, how it leads to all these chronic illness issues. Now, that's a bad thing. Now, the good thing is that there is a way to start to back this up and repair the damage. And that is really through the exposure of red light. It does start to reverse the effects. Even in the retina, there's a study that shows a red light exposure to the retina actually improved visual acuity. I believe it was by 27%, which is a lot when you're talking at visual testing, right? Not a lot will actually improve visual acuity. So that's a big deal. So we need to take note of that. So that's where, it's super important to get that exposure of light. Absolutely. But we need to understand that every touch point with light that we have matters. So if we're sitting under a fluorescent light, that matters. If we're sitting in front of a screen all day, that matters. If we're scrolling on Instagram all day, that matters. Now so many conversations we can have about that. But so all of these light points, all of these touch points with light matter. And we have to combat all of those times that we are, unfortunately being bombarded with this type of light. We have to combat that for not only our sake, but also for our next generation's sake, because we are altering epigenes. We're seeing changes in epigenetic expression, which means we can start to alter genes that we're propagating to our offspring. So it's a big problem that we need to acknowledge and we need to address.
Yeah, absolutely. One of the first things I do every morning is go open every single shade in the house. And then at night when it gets dark, I'll go around and close every shade. It's kind of like my morning and evening routine, but I try to avoid having lights on as much as possible. Obviously, you have to do that in the dark or sometimes early in the morning, but I want, right now I don't have my lights on. I just have as much sunlight as I can possibly get in my house. And I find it makes a big difference for me. I do wear blue light blocking glasses at night. And now when I don't wear them, I feel the sensitivity to it. It's almost like, whoa, that's so bright. And so those are a couple of things that have personally helped me a little bit on a small scale.
Absolutely. One thing, if you don't mind, there is a little trick here. There's an app. It's called Light Meter. And what I tell people is download this app. I think it's free. I don't remember. It might have a small fee. But when the sun goes down, get this Light Meter app out on your phone, whatever, and go through your house. You want the intensity of light, which is measured in lux, L-U-X. You want it to be below 30. So if, we have dimmers on every light in our house, and so we'll go through and we'll dim all the lights, but we need the lux to be below 30 once the sun goes down, so not to disrupt the circadian rhythm.
Very cool. I like that a lot. That is amazing. I actually also bought a light bulb for every bedroom that I bought it on Amazon. I heard someone talking about it a while back, and it was like, I think it's called baby nighttime light bulb or something like that. And it's like a very kind of like not bright, I guess it's meant to help babies and help sleep and stuff like that. So I try to keep that on. And when I do turn on a light, like in the bedroom, for example, I'll try to use that light. But that's really cool. Definitely will have to check out that app as well. Let me ask you about, you mentioned so Tourette's and even before we started recording, I think you mentioned stroke. People are very common in your practice that you see. And it's something that's it's kind of near and dear to me because my father had a stroke a few years ago. And unfortunately, it's been really downhill for him ever since then. So, I mean, he was probably a young, in shape 78-year-old, and now he's an old, not doing very well 82-year-old, and that literally it's a direct and clear correlation from when the time he had, I guess, multiple strokes. Luckily, he still has full range of motion, although he can't really walk much by himself. He's using a walker now, but I'm curious, if someone is dealing with maybe a family member like myself who has suffered from a stroke, I have heard now, and I wish I knew this a little bit earlier, I wish I would have done the research back then, but hopefully we'll be saving some people who are listening now. Is it really important to attack it as quickly as possible after the stroke happens? Is there still hope if it was 3-4 years ago? Really curious to hear your thoughts on that.
Absolutely. So my initial answer, I have several answers for you, but the answer is yes. The sooner we can get started on that, the better. I think why is going to maybe surprise you a little bit, but then I'm going to come back to that. But something that's very important to understand is the concept that so many people have wrong and so many medical professionals have wrong. And that's that just because you're old, I'm not saying he's old, he's not. And, I'm a biohacker. I'm going to live until, I'm well into my hundreds, but does not mean that you don't have neuroplastic change. It does not mean that you're not able to mold and change your neurology. And there was even a study on a group of hospice people, right? So people actively dying in hospice care on tons of medication. This is the group of people that should have solidified this notion that neuroplasticity does not exist in this population. Well, what they found is it actually does. So the brain will always try and mold and change. It will always try and change until you're gone. And so that's something very important to understand, is that there's always hope. There's always something that can be improved upon. Even with genetic disorders, we see that there's functional changes that can be made. And the thing about why we should get on top of this as soon as possible actually has to do with something called an energy crisis. So with any type of brain injury, whether it's stroke, whether it's a TBI, whether it's a drowning, whatever it is, there is something that happens in the brain, and it's called the energy crisis. So here in Texas, a few years ago, we had this huge freeze. I don't know if you guys did in Vegas. I don't know. But everyone, went inside. I think we called it like snowpocalypse or whatever. Everyone runs inside, turns on the heater, and it lasted for several days. I think it lasted like over a week. But what happened was the energy grid started to be taxed too heavily, and we started to have rolling blackouts. This happens in the brain. If you have this sustained trauma and it's significant, then you can actually tax the energy grid and you go into this energy crisis state. Now, what that can do is that can create significant plateaus for recovery. If you cannot exceed a certain metabolic threshold, even if you're doing your PT, your OT, your speech, or whatever it is that you're doing, which is phenomenal. I'm not saying don't do that. But if you have not addressed the energy crisis, then you're going to have plateaus and you may not even get significant enough change to create positive plasticity. You may, in fact, continue to downtrend in negative plasticity. And one thing that's very important, and there's a Harvard study that says this too, is that laser and light therapy should be a primary modality used for brain injury. It should. Why? Because one of the primary things it's going to do is it's going to address the energy crisis. It's going to modulate blood flow. It's going to modulate inflammation. It's going to give the cell the energy it needs. Just like I said earlier, whatever that cell needs to do, it's going to do it better. So this is why our therapy is so effective. And we've created something called the NeuroSolution ESM methodology. And ESM stands for energy, sensory, and movement. And that's how we progress people through care. We first start focusing on cellular energy. We'll do that with laser and light therapy. We'll do that with various electrical modalities. Of course, we go through nutritional counseling and all those things. And then we work on driving sensory systems. Well, guess what? There's sensory systems that can have a heavy impact on stroke rehab. For example, if there's a paper I can point to that if you stimulate the Simba concha in the ear, which is a pure patch for the vagus nerve, the auricular branch of the vagus nerve, if you do this, and there's different timings that you can do it before, during, or after, depending on what you're trying to do. Motor planning activities for someone with stroke rehab, you have much better outcomes. So that's a sensory strategy that you can take to precede a motor activity, right? And you get better outcomes. So that's the thing. Yes, the sooner the better in so many different regards, but most people don't understand the energy crisis. Most doctors don't understand the energy crisis. And even several years out, you can still be suffering from that. So that's something that's very important. And you do not address the energy crisis by just resting. That doesn't do it. And you dang sure don't do it by resting in a hospital bed under a fluorescent light, because our cells need energy and that fluorescent light doesn't give us cellular energy. So I hope that answers your question, and we can definitely, dive in to see what we can do to help your dad in various ways, offline, if you want.
I really appreciate that. Really, really appreciate that. And I highly encourage people, because again, no doctor mentioned to me, hey, after the stroke, maybe you can look into laser therapy. Maybe you can look into anything. It literally, there was nothing. There was nothing at all. So yeah, I think this is a great resource, and I highly encourage anyone who has had a stroke, whether it be very recent or even a couple of years ago, a few years ago, to really look into this. And I'd love to speak with you offline about it, and highly recommend other people look into this as well, because this is a big deal. I mean, I've seen my father age about 20 years in 4 or 5 years, right? So I think, accelerated his rate of aging by about 4x, since it happened. So this, I think for people to be able to address that quickly is just so important. And then you mentioned, so what about people who, if someone has a head injury, let's just say someone falls, hits their head, and then they got a bump on their head or something like that. Is that something where most people should just, rest and relax? I know obviously there's a big thing with football players and the head contact there. I'm sure you've probably had many people, from concussions and things like that there in your practice. But what do you think about, like, if a regular average adult hits their head, hard enough where, it swells up a little lump or something on your head? Do you think that's serious enough, or a reason, or should people look into that, or should they just rest and ice it? And just curious your opinion on that.
Yeah. For mild to mild moderate head injuries, I'm still not a big fan of just rest. That doesn't make sense from a neurophysiological standpoint. Our brain needs two things. It needs fuel and it needs activation. So if we're sitting in a dark room and we're not moving and we're not doing anything like that, right? That's not necessarily giving our brain what it needs. So our brain needs fuel and activation. So we need to optimize nutritional support. First of all, we need to make sure that we're getting plenty of fatty acids, specifically DHA. As long as there's no, concern of like hemorrhage or, anything like that, which typically, mild to moderate head injuries, that's not a concern. Oftentimes a vasodilator can be very beneficial for these people. I like
what is that exactly?
A vasodilator. So it's something that increases blood flow into the brain. So vinpocetine is a nutrient that will dilate vessels centrally. So it'll make vessels increase in size, so to deliver more blood flow. That can be done. What I also don't want to do is I don't want to load up on anti-inflammatory. So I don't want people taking a ton of Advil and, stuff like this, because we don't want to squash that inflammatory response. Again, this is mild to moderate situations. That inflammatory response is there for a reason. What we want to do is we actually want to balance it and modulate it. And physical receptor activation will do that. So getting up and, going for walks. If it's, as long as it's mild, light jogs, stuff like this. We don't want to do like trampolines. We don't want to do anything that's jarring. Okay. So movement is very good. And there is research that says aerobic activity after any type of head injury is a good thing, right? So we want to be stimulating our circulatory system, moving our muscles, moving our body. This is very, very important for a swift and full recovery, because what people don't realize is if we bump our head and we're like, okay, I've got a sore spot on my head, whatever, I'm going to go about my day. But then we're living an inflammatory life. We're consuming, food that we shouldn't be, highly processed things. We're sedentary. We're getting this bad light exposure, right, that we already went into. Well, this is continuing to drive a problem. And that problem is going to continue to propagate. And then it turns into an even more inflammatory event that can drive anxiety, that can drive depression, that can drive a mood, a change in personality, or an alteration in circadian rhythm where now you're having sleep issues. And maybe it's a year out. Maybe you don't even connect it to the head injury, right? So it's very important to not just sit and do nothing. I don't support that at all. We need to be moving. We need to make sure we're getting good nutrition. We need to make sure that we're understanding the inflammatory response and that not all inflammation is bad. And optimizing our light. We are mal-illuminated in our society today, and it is so important to maximize your light. Get outside, move, get the sunshine. This is what your brain needs in order to heal.
That's great advice. And I'm curious because I've heard this a couple times now, and it's interesting because some people are like, "Oh yeah, I have knee pain or I have arthritis, so I take Advil, every single day, multiple times a day." Sometimes people say that or stuff like that. And I have heard what you just said in a couple other instances as well. Like, hey, listen, there's no need to numb your body's natural inflammation response. Let it do its work. Let it do its thing. So in general, are you not a fan of like if someone has a knee pain or back pain or shoulder pain or arthritis or something, would you rather see them make other lifestyle changes like light therapy and eating better and increasing their DHA and things like that, or is this, or I'm curious your thoughts on Advil and blunting the inflammation response with things like that.
If they want to get better, then sure. If they want to continue to be in pain, then they can reach for the anti-inflammatories. It's for the acute need, right? It's for I want to feel better now. Okay, well, you feel better now, but you just squashed a part of the inflammatory system that is part of this healing journey, right? And what we need to understand is that pain is telling you something. Pain is a signal. It's telling you there's dysfunction. It's telling you that there is swelling or there's inflammation, whatever is going on, right? And we don't want to just ignore it. We don't want to just, say, give me the Advil and it's going to cover it up for now. We need to address it. So if someone legitimately wants to get out of pain, then we have to explore what's the root cause. Is it, like you were saying, is it a nutritional problem? Is something that I'm eating driving an inflammatory, condition? Is my lifestyle? Am I not moving enough? So this is absolutely imperative. Again, if we want to get out of pain, if you just want to take something and be done with it, well, that's fine for the here and now, but that's going to eventually lead to a problem. I was actually at dinner not too long ago with someone. I had just met them. They had no idea what I do. And he was telling me about this condition that he developed because of chronic pain. He had, I think it was back pain or something, and he went like a decade of just taking Advil. So he was just, taking Advil every single day. And then what did it do? It ended up giving him a kidney problem. So he actually damaged his kidneys just from daily use of Advil because of back pain. And
Right.
that's unfortunate because back pain isn't, typically that hard to get rid of. I mean, obviously there's varying degrees and there's all kinds of issues to look into. But I mean, come on, like a kidney problem because of back pain, like that shouldn't happen. Our medical system should not promote that. There should be better advice given. We need to get to the root cause. Absolutely.
I agree 100%. Dr. Crawford, this has been amazing. I know we're just scratching the surface. You're such a wealth of knowledge. I want to do it again. We'll have to do it again for sure and go a little deeper maybe into some other topics. But where can people, I'm curious for myself and for my family, is there a way for people to work with you virtually? Maybe tell us a little bit about your practice, where you're located, if you work with people virtually at all, or if there are any other options for people looking for help.
Absolutely. So yes, so I'm located in Austin, Texas, actually just north of Austin in a suburb called Cedar Park. And yes, we work with people virtually often. Actually, we work with people from all over the world, literally every country. We have people flying in from all over and working virtually from all over. The website for the practice is NeuroSolutionATX.com. So NeuroSolutionATX.com. I do have a personal brand website, just a little bit more about like other ventures that I do because I do various things. That one's drbrandоncrawford.com if you wanted to kind of learn more about me and keep up, in the loop of what we're doing. My Instagram page is a really cool place to be able to see like our patient stories and kind of get a day-to-day like what we do. And that's my Instagram handle is at bcrawforddc. So that's a cool place to check out too.
Amazing. And so you work with people virtually. Are you able to do tests virtually, or you'll do initial consultations and then you'll kind of give other advice? Because it'd be difficult to do, obviously, the laser therapy directly on the head or something like that virtually. But I'm just curious for people who may not be in your local area. And I think you said you have some other locations opening soon as well.
We do. Yeah. So we have, we're located in Austin. We have an Atlanta office as well. Dr. Ryan Cedarmark leads that up. We have Dr. Kyle Daigle in Louisiana, and we are actually actively opening a center in Dubai, which is just exciting. I mean, I love Dubai. I've been there several times. This has been a project in the making for a long time. But yeah, with home care, there are so many different things that we can do. We can talk with someone, get their consult, their history, all the things, and then develop a home care plan. If they don't have a laser, that's fine. We'll find strategies. But there's other things, if it's a primitive reflex, we have, exercises and even videos and stuff like that. If it's just whatever's going on, we'll develop a solution and a plan. We'll put it together. We'll teach you and get you better.
Incredible. Really appreciate everything that you're doing in the world and the knowledge that you're sharing. And I think it's fascinating. I'm actually blown away that more people aren't talking about this. This is our first episode out of 100 something episodes. This is our first episode talking specifically about, these types of therapy. And so, yeah, really appreciate everything you're doing and hope to chat again soon. Thank you.
Absolutely. Thank you. I appreciate it.
Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.